Okay, we're jumping right in with some really urgent news for thousands of seniors across Georgia. If you, or maybe a parent or loved one, are on a Sonder Health Plan, you absolutely need to hear this. What we're about to cover is critical for your health care.
So just to be super clear, this affects anyone who's enrolled in a Sonder Health Plan. That means their Medicare Advantage plans, and it also includes their chronic or dual special needs plans. If that sounds like you, you're going to want to pay very close attention.
All right, here is the bottom line, the most important piece of information. Your Sonder Health Plan is officially ending. The termination date is set for October 1st, 2025. And what that means is, after that day, your current plan, your coverage for doctors, for prescriptions, all of it is gone. It will no longer be valid.
So what is actually going on here? And, more importantly, what does this all mean for you and your healthcare? Let's break it down step by step so everything is perfectly clear.
The state of Georgia has officially stepped in and put Sonder Health Plans into something called receivership. Now, in plain English, that just means the company was found to be financially unstable and the state is forcing it to shut down. This isn't their choice. It's a mandate from the state to protect consumers like you.
Now, before we go one step further, let's get this one thing straight, because it's the most important thing to remember. You will not lose your Medicare benefits. I'll say it again. Your core Medicare coverage is completely safe. This whole situation is about your specific plan from Sonder, not your actual eligibility from Medicare itself.
This brings up a really crucial question, right? With this deadline coming up fast, what would happen if you just did nothing at all? It's really important you understand the answer because the state does have a default plan for people who don't make a choice.
Okay, so if you don't actively go out and choose a new plan by the deadline, you won't be left completely high and dry. But, and this is a big but, you're going to be put into a default situation that you have zero control over, and honestly, it might be a terrible fit for your health needs.
First, you'll automatically be moved from your all-in-one Medicare Advantage plan right back to original Medicare. That's just your Part A for the hospital and Part B for your doctor visits. But wait, what about your prescriptions?
Well, here's the kicker. You will also be automatically enrolled into a completely random Medicare Part D drug plan. I mean, literally, a computer will just assign one to you. There's absolutely no guarantee it'll cover the specific medicines you take, or that your favorite pharmacy will even be in the network. So doing nothing, it means you're giving up all control over your healthcare choices.
But here's the good news. You do not have to let that happen. There is a clear path forward that puts you right back in the driver's seat. And it all starts with what's called a Special Enrollment Period.
The Georgia Insurance Commissioner has created a Special Enrollment Period, or SEP, for every single person affected by this shutdown. Think of it as your own personal protected window of time. It lets you research, choose, and enroll in a brand new plan that actually fits your needs, and you don't have to wait for the big annual open enrollment in the fall.
All right, let's walk through these dates. You might want to write these down. Your Special Enrollment Period kicks off on August 13th. Now, the most important date to circle on your calendar is September 30th. That is your priority deadline to pick a new plan and avoid getting stuck with that random default option. Then, on October 1st, your Sonder plan is officially gone. And finally, your last day to make a change is October 31st.
Let's just focus on that one date one more time, because it is that important. September 30th. That is the magic date. It ensures you get a smooth transition into a plan that you actually chose, with no gap in coverage and no nasty surprises on October 1st.
Okay, so you know you need to take action. The big question now is, what are your options? How do you even go about picking the right new plan for you? Let's take a look at the different paths you can take.
This little table here really simplifies your choices based on what's important to you. For instance, if you really liked that all-in-one style of your Sonder plan, then you'll want to look at a new Medicare Advantage plan. But what if your top priority is freedom, the ability to see any doctor in the country that takes Medicare? Then switching to original Medicare and adding a Medigap plan is a fantastic option. And if you really want to customize your drug coverage, you can pair original Medicare with a Part D plan that you pick yourself.
And you know what? To get started, you only need 3 simple things ready to go. Your red, white, and blue Medicare card, a quick list of your doctors and any specialists you see, and a list of your current prescriptions. With just that little bit of info, you'll be all set to find a plan that's a perfect fit.
Now, I totally get it. This can feel pretty overwhelming. It's a sudden change, there are deadlines, and these are really important decisions. But I want you to know you absolutely do not have to go through this process all by yourself.
I mean, trying to compare dozens of different plans and make sense of all the fine print,
Especially when you're on a deadline, it's just stressful. And that's exactly where we can step in and help. At Georgia Safe Retirement Planners, our only goal is to guide you through this and make it as simple and as stress-free as possible.
We use a really straightforward 3-step process. First, we do all the heavy lifting. We'll compare every single plan available to find the ones that let you keep your doctors and cover your specific medications at a good price. Second, we handle all that tedious enrollment paperwork for you, making sure it gets submitted correctly and on time. And third, we follow up to confirm that your new coverage is active and ready to rock on October 1st, so you have complete peace of mind.
So the next step is really simple. Just give us a call for a free, no-obligation consultation to talk about your options. Our service doesn't cost you anything. Our job is simply to help you find great coverage before that termination date hits. The number is 470-888-7233. Don't wait until the last minute. We're right here, ready to help you get this sorted out and make sure your health is protected.